Roland asks, is it possible to do an annual wellness visit, an AWV, with telehealth platforms? Can they be done remotely?
Well, thanks, Roland, for the great question. The answer, as often as the case, is yes and no. We're still working under the COVID pandemic rules that permit remote AWVs. There's a bit of a challenge around the mandatory measurement of weight, BMI, basal metabolic index, and blood pressure. And most people are getting around that with by either having the patient do measurements or bringing them in for a brief uh, office visit just to get those measurements. But we expect the pandemic rules to end sometime in the next 18 months. It could drag on, but when the pandemic rules end, we have to go back to in-person AWVs. But I think in that that non-pandemic process where it's in person, it doesn't all have to be in person, and I think this process works extremely well as a combined remote in-person process. Uh, and the way I would do it is give the patient constant access to an HRA, health risk assessment, at home. Let them complete that in their own time. And I say constant because I'd like to see them have access to it all the time with an automated set of rules that flow out of that. If I have diabetes, I need to get periodic hemoglobin A1Cs and eye exams. And if I'm this age and sex, I need these preventative interventions done. These are the immunizations I should get, and when, and things like that. So the patient, as their health changes, can update that HRA, that health risk assessment, and get up to date recommendations um, through the system. But once a year, I think there needs to be a meeting of the minds, if you will, a face to face visit in which the provider reviews the output of the HRA and the recommendations with the patient, answers any questions that they have, learns from the patient the patient's priorities and goals, and has an opportunity to negotiate those, to say, well, yeah, I know, I understand you want to do this first, but I think this is more important to your longevity and is foundational to get this done, that kind of thing. I think the patient doctor relationship would benefit remarkably from this, and you can proceed through the year with a better handle, a better shared set of goals and priorities. The couple things that I think it makes sense to do it face to face, although I recognize that some people are just primed to take those recommendations, and I expect at least 20% of the time, if not more, patients are prepared to accept the recommendations based on those diagnoses. But when they're not, it's best to see them face to face. If they have some skepticism about one of the diagnoses or one of the recommendations that flow out of that, you may only notice face to face that there's the raising of the eyebrows or whatever it is that clues you in that they're not entirely on board. Um, and there's often some uncertainty about the diagnosis or the classification of the diagnosis. Getting into these details makes some sense. There's often management choices. Do we start here or we start there? Do we go to physical therapy or surgery? Those kinds of things can benefit a lot from some face-to-face negotiation. So, I recommend everyone do annual wellness visits. I think it's a part of it's a strong part of a patient-centered approach moving forward. Um, and even if you can't do it all remotely, I think it makes great sense to use some remote touch to get those done.